Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Gastrointestinal issues, they affect millions of people. About 70 million people in the U.S. have GI problems, and they can really make you miserable. So how do you identify what exactly that is and what help is there out there? We are talking with Valley Health gastroenterologist Marc Subik about that today. Thanks for being here.
Yeah, good to be here.
It's a lot of great information because a lot of people deal with tummy issues. So tell me, how do you know if you really have gastro problems?
Well, the GI tract is quite extensive, going from your mouth and all the way to the rectal area. So there's a lot of organs in between, and all can cause potential issues. So whether it's esophagus, it's gallbladder, it's liver, stomach, pancreas, small bowel, colon, and they all have their own presentations for disease entities. So as you can imagine, the presentation for gastrointestinal illnesses can be quite varied, but some of the more common ones would be abdominal pain of different types, nausea, vomiting, heartburn, diarrhea, constipation. Weight loss can have GI origins, GI bleeding, whether you're throwing up blood or passing blood in your stool. Weight loss can be a manifestation of GI problems. So depending on the organ system involved, that will give you a hint as to whether it might be a GI problem or not. But the presentations can be quite varied.
How about your habits, dietary changes? Will they help in situations? Should you try those kind of things first when you start having some of these symptoms show up?
Yeah, there's certainly nothing wrong with that. And a lot of people don't tolerate certain types of foods. And that really is sort of a individual type of situation, whereas one person can eat Brussels sprouts, cabbage, and onions and have no problems. The next person will have nausea, bloating, gas, and distension. So changing your diet can have a big impact on GI symptoms, and it's a safe and simple things to do. But people have to be aware of the types of food that they're eating and whether there's subsequent GI issues associated with them. And oftentimes that does happen, whether it's a carbohydrate issue, whether it's certain fruits, whether it's milk and lactate and lactose intolerance, spicy foods, greasy foods. It's unique to each individual person. But if they have that awareness and can tie certain symptoms into certain foods, then adjusting your diet is a safe and simple way to eliminate GI problems to begin with.
Do some of these things come on with age? Can you tolerate something in your youth and then when you get older it just doesn't work anymore, or vice versa? Yeah,
it does happen. But usually it's a chronic problem. Obviously it's chronic, but it has to start sometime, right? And so you do see adults that all of a sudden say, I'm just not able to drink as much milk, or I don't tolerate chili like I used to, and that can happen. But depending on the degree of symptoms and how troublesome and bothersome they are will help to determine whether you have to proceed with a diagnostic workup, if you will.
Right, and very quickly, the red flag warnings that you should definitely bring up to your provider as soon as possible, that it might be a big issue. Yeah,
from a GI standpoint, if you're having trouble swallowing with sensation of food sticking, we call dysphagia. That's a worrisome potential problem. If you're throwing up blood, if you're passing blood, if you're having weight loss, if on basic labs you're anemic and it's a new anemia, liver tests are maybe abnormal, liver function tests, those are red flags that deserve more of an investigation.
More of a mention. All right, Dr. Subik, thank you so much. A lot of great information. We appreciate it.
Thank you.
Thanks for checking in for Monday Health Minutes.